student doctors probably watching this, and they're thinking, I've had this dream for my entire life. And you have to get into the space where there's this unhealthy narrative that you guys are heroes, but we forget that you're human.
If you could mobilize a group of people, what movement would you mobilize and why?
I would call my movement the mindful movement. Suicide is one of the leading causes of death between people aged 15 and 29. 1 in 3 people are expected to suffer from mental illnesses in their lifetime. So I believe that mobilizing people to strive for mental health would actually fix so many social ills in our society, and that is what I would mobilize.
Hi everyone, welcome to Mindful Mondays. Today we're going to be talking about young doctors on the front line, and we've got Dr. Anesu here with us and Dr. Cyan today. And I think it's quite an important topic because we look at doctors as these heroes, but we forget that they're human before anything else. And we constantly have these unrealistic expectations of them. And I was watching a video that you were on earlier, Anesu, and I was very taken aback by what you guys are going through. You know, I have a friend that's a doctor, and you always manage, as doctors, you always manage to put on a brave face and a smile on your face. And when I heard everything that you guys were going through, it was the Quiet Implosion video, everything that you guys are going through, I was taken aback. I was really taken aback. So I think before we even start, I just want to say thank you for your service. And I'm going to say the same to Cyan. Thank you so much for your service, and we do not take what you guys do for us for granted at all. And I'm so glad that you're having this conversation with us, because I think it's quite an important one, especially in a society that I think it romanticizes burnout. It romanticizes burnout. It romanticizes exhaustion and constantly being busy and not actually checking in. The more you work like a machine, the more you're considered to be the best at what you do. But if you don't check in and you burn out and something happens, then what was the use, you know? So thank you so much for actually coming on here. And I see a lot of people recognize you talking about Survivor.
Yes, that's one of my other exploits. You know, we're all about the adventure. We're all about dreaming and doing new things. But yeah, I think, like you said, this topic is so important. And you know, I've been following along Mindful Mondays. I love what you do. It's so important. And I think to consider what our healthcare workers go through in terms of mental health is such an important discussion to have. And Cyan was actually the brain, the idea person behind the documentary. And really, she was the one who encouraged me to share my story. So I'm just so grateful, you know, to be surrounded by women who take these topics seriously. And I think that it seems to me like this is where we are the change makers. You know, it seems like women are really about nurturing. We are, I would say, you know, quite used to self-reflection, checking in on ourselves, although we could do better. So it's just wonderful to be here. Thank you so much.
But also the fact that you're speaking out on this, I think for the longest time, especially with the medical profession, it's like the medical profession for so many people. So it's almost like when you get it, you need to be grateful, you need to be, so I see Cyan here. So it's almost like you have to just take whatever comes. But during the pandemic, whatever conditions you guys were facing before, because it didn't only start with COVID, it actually got exacerbated by COVID. It's just that now people are more cognizant of it because now we're speaking about the issue of mental health and just COVID in general. Hi, Cyan.
Hi, Shudu. Hi, Anesu. I apologize for my technical difficulties, but it's really great to be here. And sorry I missed your intro.
No, I was just telling Anesu, Dr. Anesu, that we salute you for your service. I think I was watching the Quiet Implosion just now before I started Mindful Mondays, and I was speechless at what the doctors, especially young doctors, are going through, how many sacrifices you have to make on a daily basis just to perform at your optimum. But I'm very happy that we're having this conversation, because behind all of that are human beings, I believe. Human beings that still need to check in, human beings that still need to take care of their mental health. And the fact that you guys are speaking out in a society, I was telling Dr. Anesu that in a society that romanticizes burnout, exhaustion, and constantly feeling like, okay, I have to wake up and or be awake for 24 hours, then prove that I'm the best in what I do. But I think this is quite important, because we always look at you guys as these superheroes, and we never really know what happens in terms of your mental health in the space that you're in.
Absolutely, and I think that's why I made A Quiet Implosion, is I think there's a lot of unknown narratives about what really goes on, what people really feel regarding the hours that they're working, the trauma that they're seeing, and I think for a long time there hasn't been platforms to share those narratives, to normalize talking about this. And I'm really glad we're doing this tonight, because I think that these type of conversations need to become more mainstream, so that these narratives aren't hidden and only spoken amongst healthcare workers, that the realities are actually normalized and brought to the surface.
No, because I see on social media there was a time where we're just seeing rest in pieces, like people dying every single day, and as a spectator, like on the other side, I'm not even a doctor, I would feel it's almost like something is taken out of me. Like you feel exhausted, you feel like it is a pain that you share with whoever, you may not even know them, but you feel like you share the pain. And then you think about doctors, you guys have to watch this happen, like a lot of doctors have to watch this happen, and it's not even just one person a day, it's probably even more. And hearing that, and especially with the Quiet Implosion, it was just like, oh, by the way, they have to see this, they have to go through this. And as spectators, we're just like, okay, it hurts, but for you guys, you have to go through the trauma every day, and we still expect you to be okay. So I'm very happy that we're having this conversation, and I'm ready to get asking, like in terms of the questions. Are you guys ready?
Yeah.
Okay, cool. So these questions are directed to both of you, so I'd like to hear both of your opinions as healthcare workers. Has mental health of doctors always been put in the back burner?
So would you like to go first, or should I? What do you prefer?
You take the lead on this one, and I'll follow up.
Okay, awesome. So, Shudu, I think from my experience, I'm one of these doctors who enjoyed the medical system and then decided to leave for my own mental well-being and for my own, self-care. But from my experience, both in medical school and as a junior doctor, that was what I knew. I knew it was normalized for doctors to suffer from depression, burnout, anxiety. But behind closed doors, if anything, you would never hear about, the word burnout was never uttered in the hospital. No one would talk about what they were going through. And it was only if you had close friends that you had studied with during medical school that you would speak to, you weren't at work, who would then speak to you about having to use medication just to get through the day, having to go on antidepressants, anti-anxiety pills, but feeling like there was no one to speak to in the work environment. And I think one of the reasons why it's perpetuated is because of that very fact that, like you mentioned, doctors are seen to be these kind of hero, self-sacrificial people in our societies, where we're almost put in the category of being not quite human. And so the medical fraternity also ties that in and buys into that illusion, if you want to put it that way. And from the moment that you enter medical school, you're told that, your patients come first, your work come first. It's going to be difficult. You're not going to sleep. You're probably not going to eat well. But that's what being a doctor is about. So that was definitely my personal experience.
Cyan?
I think for me, firstly, let me say I don't think it's just doctors. I think this conversation permeates to many other healthcare workers, our nurses, OTs, physios, and the essential workers that have often borne witness to the same traumas we see in the hospitals, even if they are cooking the food, cleaning the floor. So I don't think it is just doctors that we're sharing about, but obviously Anesu and I can only speak for our personal experience when it comes to our profession. But I definitely agree with Anesu, it's completely normalized, and I think the thing that scares me is that it's seen as almost a passage of entry into medicine, that you build this wall of silence, and And I don't think any human copes well when you don't sleep for 30 hours and when you witness intense trauma and when there's a culture often of bullying, of very steep hierarchies, and I don't think anyone can really thrive in that environment. But I think it's just become so normalized that part of being a good doctor is also keeping quiet about that. And I think that does a huge injustice to our patients, to ourselves, and to our society, because it furthers this really unhelpful rhetoric you mentioned around heroes. And I don't think that's helpful for anyone, because I think we need to think about systems of care where they're healthcare workers and there's patients, and we have equal parts in figuring out, you know, how do we build a healthier society for everyone. And when doctors are called heroes, I think it creates false expectations, false hopes, and it puts a lot of internal pressure. And I think medical schools, you know, of course you learn about mental health from an intellectual point of view, but there's no, well, I can't say no, there are some attempts, but it's not mainstream for our curriculum to include talking about these issues in terms of actually tools to cope with what happens, and learn to debrief your colleagues, learn to normalize saying, hey, I need a day off, I'm tired, I'm exhausted. And I think that's not changing quickly enough. I think the pandemic has only illuminated a problem that has been there for a long time. And I'm hoping that this illumination also means that it's given the space to air and breathe and permeate society, so that it doesn't remain this suffocating silence only held within the healthcare worker fraternity.
And you call it a suffocating silence. Student doctors probably watching this, and they're thinking, I've had this dream for my entire life. And you have to get into the space where there's this unhealthy narrative that you guys are heroes, but we forget that you're human. What would you want to tell that person right now? Like, I didn't want to jump straight to that, but then it's almost like you go into one thing and then expect, and then you get then something else happens. But from what I'm hearing is that conversations among you guys as doctors is actually quite important, or essential workers in general, like you were saying. It's quite important to actually speak about it, to know that, okay, I'm not the only person feeling this way, because this unhealthy narrative that we have, or this perception that we have of you guys as doctors, I think is also perpetuated by the silence that exists within the space, because you have this thing where, okay, I have to be great at this, I have to be a great doctor, I have to be a great essential worker, especially now during the pandemic. So what do you have to say to someone who is who's aspiring to be a doctor, or who is a doctor but is struggling to speak about what is happening within that field, or they're feeling exactly how you guys have been feeling, like, I'm exhausted, I'm tired, but at the same time it's my duty, I signed up for this, so if I signed up for this, then I have to fulfill my responsibilities. But then how do you not neglect your mental health at the same time? What do you say to that person?
I think it's important to frame this. I think it's a really great question, Shudu, but I think it's also important to frame it in terms of, I don't know if anybody signs up for their degree knowing what happens at the end. You know, having realistic expectations of what do you think your qualification will mean in terms of work. So it's not just a thing of medicine or health degrees. And I think importantly, what I would say is that I don't think we need to demonize medicine. You know, it's a huge privilege to be a doctor, to be a healthcare worker. It's a beautiful profession in terms of the type of work you get to do, and you get to see parts of people's lives that few people ever get to. And so I think it's important not to demonize the profession, but to rather have honest conversations about systemic issues as well as what we can do as individuals. So I think there has to reach a breaking point, you know, similar to what we saw with Fees Must Fall. When you get a critical mass, you can really change things in society, and you can really change legacies that have been harmful for many for a long time. You know, and I use that analogy in the hope that there needs to be some form of critical mass around these issues. And as students, as young people, you have so much power, because I think every generation has the ability to say, you know, what is not okay about what's happening and how they want to do things differently. And I think medical students need to advocate firstly for to be equipped with more personal tools around managing the type of traumas that are inherent with the profession. You know, but as well to learn advocacy tools and to keep speaking out about these issues. We have to put an end to 30-hour shifts. We have to make our hospitals safer places. They've been plagued with incidences of safety, which are hugely affecting healthcare workers' mental health at work. We have to be able to normalize burnout, debriefs, and time off. And I think these conversations shouldn't be seen for students as a deterrent from the profession. I think they should be seen as an encouragement to advocacy, you know, not just for their own sake, but for everyone's sake, for our society's sake, so that we can really be a part of questioning, is the healthcare system that we're working in, being a part of, is it honoring patients? Is it providing dignity to healthcare workers? And if not, what can we do on both an individual level and a collective level to change that?
Yeah.
I totally agree. You know, one of the things that I think is interesting is, as a student, you are told about what it is that you're going to have to do. You're told about the tiredness that comes with being on call. You're told that you're going to have to certify patients. We even, you know, have a little touch on how to fill out the death certificate, but it's never presented to you in a real life way, a situation that has emotions and trauma behind it. And so one of the experiences that I shared in the documentary was being a young doctor on my first call in medicine and having to certify all of these patients dead and having to tell their families that had happened. And while I had been told how to fill in the form, nothing prepared me for the emotional, almost hit that I took from seeing someone's loved one passing away, being the first person who essentially puts that in writing. And so I think, along with what Cyan's talking about, along with the systemic change that I think students should be encouraged to bring about, there also needs to be a degree of emotional coping skills that students are taught, along with the theory that they are taught in medical school. Simple things like, you know, when you encounter a difficult situation, before having to break bad news to a family, how do you manage your own emotions before and after that engagement? If you're feeling tired on call and you have 1 hour to rest, what's the best way for you to use that 1 hour in order for you to feel refreshed, restored, and eager to start your work again? And so I think it's just about not really changing the curriculum per se, but changing the way in which we teach it so that doctors are prepared for the emotional baggage that comes along with the work that they have to do. And those steps, you know, these coping mechanisms that we're talking about are not difficult things. You don't need equipment, you know, you don't need to be anybody special to breathe, to take a moment to do a body scan, for example, to listen to a guided meditation. And so I think it's just about bringing that human element to the curriculum so that students are prepared for the humanity that comes with being a doctor or being a nurse or being a physio or allied health professional.
And I'm so glad that you guys...
And Anesu, can I piggyback on that and just add, it would
Sure.
also be amazing if we saw healthcare worker students train together in a more egalitarian way. So doctors, nurses, OTs, physios all working together, because we have to be honest and say that the hierarchy that doctors build for themselves is also a problem. We can't say, you know, we have problems but we're not contributing to them. And I think that hugely impacts the mental health of other healthcare professions when doctors sometimes don't treat the allied health professionals with the care and respect they should, and sometimes vice versa. And so I think also a really collaborative and teamwork approach much earlier on would be really wonderful if people could be self-aware and also develop the leadership skills necessary to work in teams effectively without perpetuating these hierarchies.
And you guys made such great points, which goes back to what Cyan was saying in the beginning, how you may know about mental health in theory, but then when it comes into practice, it's a completely different story. Because as you're talking, it's like, okay, as doctors, you guys should know about mental health more than anyone. But at the same time, there's also this thing like that's looming in the air that, okay, you also need to be superhuman. So I'm glad that you guys are bringing up these points in terms of advocacy, but in terms of just learning to check in with yourself, or being taught how to check in with yourself, and being told that it's okay. I think we constantly say that it's okay to not be okay, but sometimes maybe we feel like it's only applicable to certain individuals and not all of us. So it's quite important that from you guys are saying this as young doctors, for those that are watching as well, to know that, hey, okay, there's days where you're going to feel tired. That's okay too. Doesn't mean that doesn't make you less of a health worker or a healthcare professional than the next person. So that's quite important. And I just wanted to ask, has there been any change in young doctors' mental health during the pandemic? Because you guys have worked through this, but then you find that there's student doctors or that are doing their internships or their community service and whatnot. But has there been any change in their mental health from your experience?
I think, what I've heard from my peers who are, junior doctors working on the front line, is that it's gotten worse. I think one of the things that COVID has done to everybody is show us our humanity, but also show us where the holes in our system exist, in all of our systems. And so I draw upon one story that my friend told me, where she said she was particularly triggered or traumatized because she was dealing with a patient, talking to a patient with COVID who was exactly like her. They shared where they grew up, they even knew similar people, and that patient ended up not being able to make it, but that was just one of hundreds. And so I think what the pandemic has really done is to show everybody that nobody is immune, nobody is immortal, nobody is special in terms of their health. And that goes for our healthcare workers as well. And so I think we're definitely starting to see that the load that our healthcare workers are carrying is a lot heavier with the pandemic. And so, I think the systems are beginning to be put in place because it's becoming so obvious that healthcare workers can't cope. But I definitely think from an emotional standpoint, apart from having to deal with the stress of instability, of not knowing what's going on with the future that everybody in our society is facing, on top of that, having to witness the death, the sadness firsthand is also something that our doctors have piled on top of that. And so I think it's really the time where we need to put into place effective measures, mainly on an individual basis, I think, because it's really urgent for it to happen now, and systemic change takes time. But to give doctors the tools as individuals to be able to cope with the things that they're seeing during the pandemic.
I think I'll comment from the student perspective, because Anesu's covered sort of the young doctor perspective. So as part of the project that I did, which produced A Quiet Implosion documentary, we also did online workshops last year for medical students at the University of Pretoria around mental health and coping strategies. And so I'll just speak a little bit about what I learned from engaging in that space, is that I think medical school is already a really stressful time. It's 6 years, the workload's extreme, and, the challenges all students have to face nationwide, medical or not, regarding remote learning, adapting to, how do we do classes on Zoom, how do I be far away from campus, having to learn in my home, which maybe I'm sharing with many people, or I don't have data. I think, so these were the usual challenges that medical students also faced. But I think on top of that, for those moving into their clinical years, there was a lot of fear. And unfortunately, I think there was just not enough provision of psychological support, in a group or one-on-one. Proper debriefing about, what it means to be going into a hospital ward where there's a pandemic, which at that point we didn't properly understand as a student. Because all of us, I remember the first time I went out, after that level 5 lockdown, and we were all panicking about what it means to be in a pandemic, which we don't understand. And these students had to do that from very early on with limited support. And I think that's really going to affect this generation of doctors. I think we need to find ways to prioritize that they're able to be in the system right now, in medical school and into internship, with access to a lot more support, and not make it difficult in the sense that they have to phone and book ahead for psychosocial support when their timetable actually doesn't allow, or where they may not, if the university doesn't provide it, they might not have the funds to seek additional care. And I think we also have to find ways of doing this in a group, right? I know we need one-on-one when there's acute trauma, but how do we normalize just sitting with someone to provide psychosocial support and talk about it as students? Because I think our students have been really hard hit. And, all the usual stress of medical school and internship doesn't stop because there's a pandemic. It just amplifies it. And I think it's provided a really good opportunity as well for medical schools to think around how do we provide psychosocial support on an ongoing basis, not just when there's an emergency, because the pandemic made very clear students are not coping. The data from the workshops we did showed that very clearly. But we can't just respond by saying on a one-on-one basis we'll sort that out. I watched a TED talk by a social worker in the UK speaking about burnout, and she said something so poignant when thinking about how to address this. She said addressing it on an individual level is like putting out a match when you're standing in a forest fire, is that we actually have to address this collectively. And the most benefit of having students all in one cohort at the moment is that you can actually provide support to them all together without having to necessarily do it one by one. So I think we really need to leverage that because there is a definite need at the moment.
And you speak a lot about collaboration and just breaking the hierarchies that exist in medicine. How do we break the bullying culture in the medical field?
That is a
Great question.
Sure. I think probably neither of us, all of us, and none of us have the perfect answer. But I do think it's important. We have had some really brave doctors who have spoken out, and Anesu, I include you in this, was speaking out in A Quiet Implosion. But we've had some doctors speak out around bullying, around sexism in the workplace, around racism in the workplace, and often that's come at a huge professional and personal cost when it comes to their careers and their well-being. And we haven't always seen the support of our union, who sometimes stays very quiet when they're actually really needed. We see lots of letters with fancy logos, but we don't always see the support of our medical unions when it comes to individuals who've been speaking out. And I think it's really challenging because you have to put your neck out and that endangers your career. But until more of us do it, that probably won't change. But at the same time, I think addressing it without empathy for why it's happening probably won't help. I think probably the same people who traumatize juniors and who are part of the hierarchy and who bully others, they were probably bullied themselves. They're just repeating cycles of trauma that nobody has helped them process, and so they just transmit it. And so I wonder if a system that leveraged more empathy for people at all levels and provided the support for people at all levels would help and prevent the transmission of bullying and trauma just from one generation of healthcare workers to the next.
And there's something that you spoke about before you answer, Anesu. You spoke about advocacy earlier. I was speaking to my friend who's also a doctor, and she spoke about how when you guys rise up together, a lot can be done in terms of what you guys deserve. Apparently there was a protest or some advocacy that happened years ago in terms of the pay that doctors receive. And that was successful back then. But I also think about how if you do it now in terms of the bullying, in terms of the work hours and everything else that's done, so much can be done when you guys stand together as doctors, but then maybe it's about breaking that culture where you feel like you need to do things by yourself and start looking at things as a collective. So that is a great point from your side. Anesu?
Who are used to having discussions about burnout, around sexism, inclusivity, all of these topics that are now coming to the forefront on social media, and to start the conversation from there, because I do think specifically for the older generation, it is difficult to imagine a world that hasn't existed in your time. And so I think it's really, as Cyan is saying, even as we look at more senior professionals, healthcare workers, once again, not to demonize them for the bullying or the harassment that takes place in the workplace, but to be able to have open conversations to try to show what could be. This is our struggle. You know, the older generation had struggles that they had to work through, and this is ours. And so I think it really is up to the youth and the younger generation who understand these topics to spearhead these movements and these conversations in the workplace, but with the support of the union, with the support of institutions, so that you don't get fired, you don't get punished for speaking out in the workplace by the people who run your teams.
And I think it also goes back to what was said earlier, how this conversation, especially what you just said now, Anesu, applies to almost every single profession. Because now as I'm listening to this, a lot of people do go through bullying in different professions. But then it's a struggle to speak out, even on your mental health just in general, because there's also that fear that what if I get fired, what if I do this, what if I do that. But I think it's about creating, not perpetuating the cycle that was there before, like you're saying, but creating a new narrative where people speak openly and freely, yes, with respect, obviously for the hierarchies that exist, because those would be very difficult to break. But it's quite important for us to start having an open conversation about it, because I see a lot of people commenting, a lot of young doctors commenting on here, and it's quite important for this conversation to be had and for the advice that you're giving them. I just wanted to ask Cyan, what support services are available to doctors?
So in terms of if you are an individual doctor that needs help, there's a few helplines that you can reach out to. SADAG, amongst many other NGOs, is doing amazing work in this area. So we have the Medical Student Support Line, which is specifically for medical students and young doctors, and you can call that on 0800 323 323 24 hours a day if you're in an acute emergency or really need help. You can also visit sadag.org or healthcareworkerscarenetwork.org.za, where there's a lot of free resources, and you can also get connected with psychologists and psychiatrists who offer their services free of charge. We also have a 24-hour helpline for all healthcare workers on 0800 212121. So those are resources in terms of connecting to help on an individual level. But I do just want to emphasize that there is definitely time and space for that. But you know, sometimes just even an honest conversation with a colleague, senior, those around you, is also really important. I think we can't negate the micro steps. It's different if it's a mental health emergency or if you're in acute distress, then definitely seek professional support of the organizations I mentioned. But you know, I think if you're burnt out and you're going through a hard time, or it's just been a really traumatic season, I think just sharing with those around you, drawing on the support of those around you will, I think, encourage others to also open up and share. And we can find a wonder of support when we tap into our collective strength and solidarity. And so I think it really depends on what the problem is, but there are organizations and many institutions that are able to help doctors. I think it's often a question of whether or not our healthcare workers know about these and whether or not they have the easy access. And so I'm hoping through a lot of the conversations we're having and through the documentary that access to help does become easier.
And within, you speak about the unions, and I'm so glad you shared those resources. If you don't mind, please send them to me so I can just share them below the video after I post it. But it sounds quite important for support groups to be available for doctors. I think even in the hospital space, like wherever these doctors work, or even healthcare professionals in general, as you're saying, because it's a collective. It's not just the doctors. There's so many other people as well that make the hospital and the care what it is. So what do you think is the importance of support groups within the hospital? Yes, maybe a psychologist may not be readily available, but then like you're saying, what if you have an emergency now? There are helplines and everything else, but it sounds like the most important conversation that you guys need to have is amongst yourselves, because you understand one another. So is there any way, like through the unions or even the hospital, that there can be advocacy for support groups to be available for doctors within the workspace?
Definitely. I definitely think there is. You know, I think, you know, rather than waiting for unions and institutions to set these support groups up, it's often as simple simple is a difficult word to use in this environment, but it's often as simple as a team who usually works together on ward rounds, on taking care of their patients, to schedule time in their work week to sit down and, along with debriefing through the treatment plans that worked and didn't work, to also debrief on the emotional issues. So often in the working environment, I think regardless of what type of healthcare professional you are, there's a time in the week to reflect on treatment plans, on patient statistics, and that's usually just an academic exercise. But I think because that's scheduled in, that would be the perfect time for whoever is in that team who might be listening to these conversations or who might feel inspired to affect change, to then raise the point and to say, actually, can we add on an emotional debrief to the agenda? Can we also speak about how we're feeling as doctors? And in that way, you also contain these conversations in the very teams that are working together, from the most senior doctor and consultant, all the way down to the medical student who might be joining that team during the ward rounds. So I think there is definitely the space and the time in order to do so. It just takes the initiative of one person on the team to be able to show the senior that this is an important topic, maybe to provide research. Our seniors love it when everything is evidence-based, so bring in some research about burnout and how effective people are when they're burnt out versus whether they're rejuvenated. Take that to your senior and ask them to schedule time in your M&M, your mortality and morbidity round or meeting, to talk about emotional well-being and I think that's a good place to start.
Can I add on there? Because I think we probably also have a lot of non-medical people joining tonight. That, they may feel now we've spoken about the importance of these groups in hospitals, so what can they do if they're not a doctor or not a nurse? But everybody interacts with the healthcare system at some point, so this issue will affect them, And I think the power of multidisciplinary teams, of people putting together resources, legal support, emotional support, financial support, to think about this issue proactively, even if you aren't in the medical space. So a different group from what Anesu is speaking of, but groups of civil society who are interested in this issue is also important, because I don't think the medical profession is not going to find solutions to this on their own. I really think we need as diverse a range of stakeholders as possible at the table, and we did actually start a working group in response to A Quiet Implosion, which encourages people from all sectors who want to get involved in this issue to join up, and I will share that link as well, who want to be a part of the solution, because I think small teams of people can have mass effect, and whether you're medical or not, I think that can happen.
And I think, and I'm glad you brought those points up, especially everything requires a collective effort, and that's exactly what I'm hearing tonight. To someone that's watching here, if you want to effect change, even if you're not in the medical space, together we can definitely do so much more. And I think if someone has just joined in now, we all have an idea as to what you guys are facing in the front line. We think that we know, like it's almost like, okay, like we're saying, we speak about that superhuman effect. But what is it really like for someone who just got on here? What is it really like to work in the front line? Like, how does it feel? Like, what does it do to your mental health?
So I'll maybe the best way is to run through the day of a junior doctor as I used to experience it. So usually work begins at around 7 a.m. Most doctors don't stay near the hospital where they work, because our hospitals are also usually, in areas that are predominantly underserved. And so most doctors have to commute to and from work. So you'll probably wake up at around 5:30, depending on how long your morning routine takes. Head into work at around 7. You'll then usually either start off with some ward work. So that's usually doing drips, taking some bloods for your patients, finding out how they manage during the night, or it can start off with a ward round. And so you'll generally spend the whole morning working through the rounds, deciding on, what work or what management plan you have for your patients. Then that usually lasts till around lunchtime. Straight after that, you then move into doing the work that you have to do based on your ward round. So what scans your patients might need, you may need to order that. Maybe calling patients' families to tell them that they're not doing so well, that a plan needs to change. That's generally what ward work entails, and that will take you till about 5 o'clock. After that, you usually are on call, so this will mean that you're working for emergency cases, and that really spans for about, I'd say, 12 hours until the next day at 7 a.m., where you're working non-stop. And this is now where the work gets really intense, because these are patients who are in an emergency setting. It's often life or death, people who are confused, often having to tell family members that their loved one needs to be admitted. And so that's a very frantic time where you've had a full day of work, and now you have often more severe, more complicated issues that you have to deal with throughout the night. So you will usually, a lot of people think that being on call means, like Grey's Anatomy, you go home and someone calls you and then you go to the hospital. That's not it at all. Usually you are in front of a patient dealing with them, and then you get a call that there are another 10 or 15 patients that you need to deal with. So that lasts the whole night. You're generally working all the way through early hours of the morning without sleep. If by this time you've managed to eat something from the time that you left home, you're doing well. Maybe you'll get 30 minutes rest in between there to just have a quick power nap. And what we usually see is that hospitals will say that doctors will leave at around 7 a.m. the following day after a call. So they'll say that doctors will work for 24 hours, but what usually happens is you then greet the new team that's come in at 7 a.m. and you have to hand over to explain, this is this patient, that's what they're dealing with, this is what the plan is. So that usually then takes you to about lunchtime the following day, where you're now ready to go home. You have the long commute back home. You've been working since 7 a.m. the day before, and then you usually have just that afternoon to rest. That's called post-call, and then everything starts again at 7 a.m. the next day.
Wow. Oh.
Yeah, quite intense. And while you're working, you're dealing with people's lives. You're dealing with children who are sick, on the brink of death. It's apart from being on your feet and that being tiring, the emotional burden of having to deal with these traumatic, high-stakes environments where one wrong decision could impact someone's life and a family's life. It really is a lot to put on the shoulders of a normal human being. If you think about how tired you feel after your 9-to-5 day at work, imagine pushing that on for about 30 hours. So it really is very intense.
And
importantly, I think it's not the same for doctors everywhere. We have colleagues who are serving in rural hospitals, which is an important part of our healthcare system, who go home after a shift like Anesu has described, but also don't have any support around them because they're there for ComServe and they're new in a community. They haven't found the ones that they feel they belong with, necessarily established friendships. And so there's also that component of, after dealing with that, a lot of the times people are having to move around the country a lot, obviously with internship and ComServe, which is an important part of providing access to care to everyone in our population. But just comes with also a huge cost. And I think there are completely different levels of experience, whether you're a junior or a senior and where you are. And just on top of that, I think importantly, sometimes the public forgets that we are in a country with a quadruple disease burden, meaning we have infectious disease, HIV and TB, we have high rates of maternal mortality, we have high rates of non-communicable diseases like have huge amounts of trauma, and so that's really a heavy load in terms of disease burden. And what that often means is that if you're tired and you're drawing blood and you get a needle stick and that patient is HIV positive, you will be on ARVs and be very sick for a month as a prophylactic. If you are in a TB ward, you are wearing an N95 respirator the whole day. Or if you're in an infectious disease ward, you're in PPE the whole day. And
I think we lost Cyan there for a bit.
Yeah, I think what she's just reiterating that, especially...
there
you go, Cyan, you're back.
We got you back.
So I don't know where I dropped off.
No,
Sorry.
I think you were just talking
Infectious
about
diseases.
you were just talking about the challenges that you guys face on a daily basis. Other than COVID, we live in a very like high infectious rate country. It's not only just that, like you touched on how if you're in a TB ward and everything else, and we, like I said, we're talking from a COVID perspective, but there's so many other factors that exist that have existed way before COVID that have been exacerbated by it. So COVID is just like another added extra onto all of that. And hearing what both of you guys are saying, I am taken aback, and like it makes me wonder. As let's say I know someone who's a doctor, or I'm friends with someone with a doctor, or I'm family with someone who's a doctor, or I'm in a relationship with someone who's a doctor. How do you support that person? How do you see when they're reaching breaking point? Because like we spoke about from the very beginning, is that there's this hero complex that you guys are superhuman, that you guys can handle all of that. But if you're working from 7 the previous day to 7 the next day, and you still have to debrief the next person, or you lose patience, or you get a prick, or you are in you're wearing the what do you call it, the stuff
N95.
N95.
Yeah.
It's almost like in that state, it's a constant state of anxiety. So how do you, as a person that is not a doctor but or a healthcare worker rather, how do you support someone who's been working in such conditions the whole day? How do you see when they're about to reach breaking point? How do you see when, okay, it's time for me to intervene? Because at the same time, as I've been seeing in the comments, there's this thing that it's my job, so I have to do it, so I can't really complain, like, you know. But as a loved one, how do I get to a point where I say, okay, cool, I can identify signs, or I can get involved? Or how does one support a doctor? Or even a healthcare worker, rather?
I think from a personal standpoint, you know, if this is somebody who's your partner, if this is somebody who's your friend, just creating a safe space where, you know, often what I found was quite difficult when interacting with my friends as a doctor was that my schedule was constantly changing. I was usually I would miss out on or, you know, lunches, brunches with my friends because I'd be on call. But I think it would be really useful to have a scheduled time in your week. I'm a big fan of routine. I think it helps to have a consistent practice. A scheduled time in your week where you jump on a group call with your friends. You know, even if you're in the hospital, if you limit it to just 15 minutes or 30 minutes, you can always take that break when you're on call, just to take yourself out of the industry, out of the sector for a moment, and just to have a conversation with your friends where you all speak about how you're doing. Because I think it can be quite intimidating to know that, you know, there's a conversation where you are the person who's forced to debrief, you are the person who's forced to share. But if everybody's doing that, and your friends are also aware that, you know, there may be some sharing that you need to do, I think that that's really useful.
Okay.
I think it's also really important for doctors to consciously engage in friendships and relationships that are out of the medical fraternity as well. I got a lot of restoration from, you know, speaking to other people about their corporate lives and laughing at what they were going through, and hearing about, you know, what people were going through with their relationships and things like that. So I think creating the breathing room to have these conversations with loved ones is super important. And if you schedule it into your time, as a doctor, you're also able to know that that's your safe space in the week. That's your time and your moment to exhale. And so I think there's so much that, you know, people outside of the medical fraternity can do to support a sister, a friend, a loved one through what we're speaking about.
It's almost like seeing you guys as humans.
Absolutely, I agree.
Yeah, totally.
Yeah.
I completely agree with Anesu, and I think, you know, the other thing is also to be clued up on the red flags is really important. I think if you have a partner, or just a friend that's in any healthcare profession, to know when withdrawal is, you know, if there's a normal level of withdrawal and then there's red flag withdrawal, if they start, you know, behaving in a way that you're not used to know when it's a red flag and to encourage them to get help is also really important.
Yeah.
And I think there's a lot we can do for each other. It doesn't just have to be a one-way stream, but, you know, choosing to go for a walk with your friends so you both get some exercise, choosing to participate in some form of community group or uplifting activity together is really important. And I think, partners and friends often get traumatized themselves by healthcare workers coming home and just resharing their trauma. And so I think it's also really important to develop processes where, if you're a healthcare worker and you're struggling, to know to make an appointment with a psychologist, to have a set time to brief, to debrief, to have a friend that you can speak to, but not just to let work permeate your home life completely, but also to try and separate to some extent so that you can be present to the ones you love and vice versa. And I think just more conversations about how we all are doing is important, because it's also not helpful if you always feel like you're in need of being helped the whole time. I think there's a certain emotional intimacy that can grow between friends, partners, and so on. If you have honest, raw conversations about how you're both doing and figure out ways what support could look like, because I think that support looks really different for everyone, and it's hard to almost have a one-size-fits-all.
It's almost like how we as individuals have to learn to love one another in different ways. People need a certain level of care or different kinds of care, and that's their love language. So we need to listen to one another and be cognizant of what the other person needs. Thank you so much for coming on Mindful Mondays today. I think I learned so much because you get to hear about this every single day. You get to interact with doctors or even healthcare workers, and sometimes you just assume that everything is okay. Even when you think something might not be okay, you just think everything is okay. But being educated on what you guys go through on a daily basis at the hospital, be it at a clinic, be it everywhere actually, has blown me away. So thank you so much for your service. Thank you so much for your service to mental health as well. I think you guys speaking out starts a whole new conversation that needs to be had, not only in the medical fraternity, but like just in general as human beings, because we assume that this one profession is, there are hierarchies that exist within different professions as well. So we feel like, okay, this one doesn't need me, this one doesn't need me. But the conversation that we had today touches on all different professions, but more importantly has opened us up to see what healthcare workers go through on a daily basis, because we just assume that all is well as long as they're doing their job and like that kind of thing. So thank you for showing us that you're human. Thank you for opening us up to what we can do, even if we're not in the medical fraternity, but how we can join the advocacy even through support groups, and how we can be of assistance. So thank you so much for taking the time out today. I really, really, really appreciate it. Thank you so much.
Thank you. Thank you for all the work you're doing around this issue.
Well, thank you so much. And Cyan, please send me those support services. I just want to add them at the bottom for anyone who's watching tonight.
I will do.
Thank you so much, guys. Thank you.
Thanks,
Have a good evening. Thank you guys for watching.
Bye, everybody.
Bye.